said most of them didn't have cravings anymore. It changed their whole outlook. They were feeling better, but the most amazing thing was they'd ask them, how many of you had diabetes before you had the surgery? And all of them raised their hand. They said, no, it's a year later. How many of you have diabetes now? And none of them raised their hand. So just that simple change that they were able to get through medical intervention, and they had to change their lifestyle too, but it was a major change, and just those impacts can have a big change on care. And I think we're going to see that consumers are going to be incented to do that, and the people that don't adapt and don't take care of themselves and don't stop smoking or don't eat right and exercise, they're going to pay more, because I'm going to demand that they pay more, because I'm spending my health care dollars. It's the way the competitive market's going to work. So I just want to finish up talking about IBM research and some of the things we're doing in research to help healthcare. It's one of the areas in IBM that I've been most proud of over the last 12 years. It's an amazing resource we have. Our leadership in patents every year, year after year. When we go up to research, Pete and I have been up there many times. It's just amazing skills and amazing things that they're working on. One of the things we have is the IBM Computational Biology Center, and they're working on some really key projects to help with improving the performance of drug discovery and other innovations in healthcare. And that's within our Deep Computing Institute. And IBM has really put a strong focus on high-performance computing to solve some of the world's biggest problems. And we've been able to establish ourselves at the top of the supercomputing charts. We currently have the top 2 supercomputers in the world. We have 4 of the top 10. And these computers are really working on major problems in weather prediction and healthcare and biology and drugs. Some of the projects that the Computational Biology Center is working on is genetic pattern discovery. They're doing bioinformatics and data mining tools to help really look into all of this mountain of data that we have in the marketplace. Another area that is very key in that drug discovery area is visualization, and it's also been an area that the high performance computing has made a major impact. Being able to give the researchers this view of whether it's protein folding or the genomic data in a 3D format, and they can rotate it and see how it's interacting, see how the proteins are folding. This is what's going to change healthcare in the future, because it's going to alleviate a lot of the things that are taking up time in the system right now. And so having these tools is really accelerating the research, I guess. If a picture is worth 1,000 words, then being able to see how a protein folds to a researcher is worth millions of words. It's just amazing that when you show that to them, what they start thinking about and what the capabilities are that they can do. Another key project that Pete and I started, that maybe a lot of you are familiar with, is Project Checkmate with Scripps Research, and FAU has been involved, and it keeps evolving. But a major problem of pandemic and infectious disease worldwide. Every year, just the common flu affects us all, and this last year, the vaccine was very ineffective. It was one of the worst flu seasons ever. So being able to use computing resources to predict, simulate, model, know where these viruses are going is a key issue, and it's a key problem that we're trying to solve worldwide. Another key initiative is the IBM World Community Grid. I don't know if anybody has seen some of these projects. You can look up worldcommunitygrid.org. It's something that all of you can help with. The community grid is essentially made up of PCs around the world. And your PC sitting at home, or all of the PCs in your company, can be set up in off hours to devote their time to solving some of the world's biggest problems. And we've had some amazing results so far. One of the first projects we work on was an AIDS project with Dr. Olson from Scripps Research. And an amazing statistic comes out of that they were able to do 5 years of research computing in 6 months. This is using your home PCs. So that's another recommended site to go to, worldcommunitygrid.org. Sign up your PCs, sign up your company, tell your friends about it, because Right now, I think the statistics are we have about 1 million PCs on the system, and we're already able to do these types of projects. But there's 1 billion PCs worldwide, so it's a lot of unused computing power that can really be used. And it's being used for other projects such as, infectious disease, and as we were talking about the protein folding earlier, I mean, all of these big problems that just require a lot of crunching. So, and lastly, one of the projects that's local to this area is the LaGrid project, which Pete has led for years at IBM and really helped form into an amazing project. LaGrid is a grid project using university computing resources with 13 universities, 2,000 systems, and 2 supercomputers, one in Barcelona and one in Mexico. And they're working on big problems, and the universities have access to that. And Quantum plans is joined the LaGrid project and plans to use it for their data analysis and coming out with good results from there. So that's really the summary of what IBM's doing. I'll be around for the rest of the day for questions. Please let me know if I can help.
Thank you, Steve. We actually have time for a couple of questions if anybody has questions. Mic's out. The mic is coming.
I know that the panel talked about platforms for healthcare. In our previous panel, we didn't delineate the difference between academic medical center that has responsibilities in tertiary patient care versus these gigantic, more general hospitals. Tell me, maybe in a nutshell, what would be the differences in the platforms, and is there some special attention paid to academic medical center?
Yeah, I mean, the main difference is the link to research. University of Miami is dealing with this right now as they expand their health system and look to automate more of their processes, create a umbrella system across all their facilities, but also in the academic medical center, they want to be able to capture that tertiary data and match it up with the research data and come out with amazing results. It's what Mayo's been able to do, and the Cleveland Clinic, and all these world-leading organizations. So that's really the difference is that data integration. It's a lot of what we work on with those customers is, how do you put all that together and be able to do the data mining in order to get good results.
I would just add to that, Stephen, that one other thing to consider in a platform sense is also to think about access and pricing. Some tools can be prohibitively expensive for many academic or other nonprofit types of organizations. And so in thinking about kind of an end-to-end view of a platform, you also have to consider how you actually foster that ecosystem and encourage other ISVs and other tool builders to build in and offer their services out for a variety through a variety of pricing mechanisms.
Hello, my name is Raif Yassin. I'm presenting DeVry University. My question for Sonia, and very good. I paid very close attention to what you had to say.
Oh, no.
Good. Now, regarding the gentleman over there question about privacy, which you actually, I think your platform would take care of that issue. And I think to some extent will take care of the financial portion, which is a lot of concern for probably doctors. Now, how you envision to implement your platform where it's going to be across, let's say, like a system wide across the United States over here, where we're going to implement this whole infrastructure? There's going to be any infrastructure changes to accept your platform in a sense? Could you elaborate the platform a little bit more? Thank you.
Sure. So I'll start with the privacy question. So Health Vault is really sort of the best and most visible example of how a patient has clear and transparent audit of any access to their data that can only happen upon their authorization. And so that kind of builds into also the critical mass